Hello, and welcome to our symposium today entitled Paying the Price for Safety, Public Safety Personnel, Moral Injury, and the COVID-19 Pandemic. My name is Hannah Sung, and I'll be the moderator of the event today. And I'd like to start by welcoming everybody, whether you are a researcher or you work in PSP fields, including fire, police, paramedic, dispatch, and corrections. And I'd like to start by acknowledging the land on which McMaster University is located, which is the traditional territory of the Haudenosaunee and Anishinaabe nations, and within the lands protected by the Dish with One Spoon Wampum Belt. This wampum is an agreement grounded in Indigenous legal traditions and also applies to where I am today, which is Toronto. This city is home to many diverse First Nations, Inuit, and Métis peoples. With a dish with one spoon, the dish represents the territory and one spoon represents that we should share the resources of the land and only take what we need. And I hope we can approach today's symposium in the spirit of sharing, and that we can always approach our work every day thinking about how to transform our personal and institutional relationships with Indigenous peoples, communities, and with Indigenous guidance. And now I'd like to welcome Dr. Margaret McKinnon of the Trauma and Recovery Unit at McMaster University. Hello.
Hey, Hannah. It's really lovely to see you. I just wanted to really reach out and welcome the audience, but also began this event by thanking public safety personnel across Canada for their service. I work very closely with the Canadian military, and we have an expression of saluting people for their service. We want to begin this event by saluting each of you for all that you gave over the course of the COVID-19 pandemic, but also before that and now beyond. We see your service, we see your sacrifice, that of your families, and we're very much hoping that today this event could help to shine a light on some of the experiences that public safety personnel had over the course of the pandemic. And in shining that light, we hope to learn lessons that we can carry forward for policymakers, for administrators, for Canadians, about how we can best serve and best support Canadian public safety personnel. So I want to also thank from the bottom of our hearts, Evan Gagnon, Brent MacIntyre, and Brandon Currie, who are public safety personnel from Canada, who are joining us today to very generously share their stories with all of us. So thank you, Hannah, and welcome to the audience. We very much appreciate you being here.
Yes, absolutely. And so just to give a quick overview of how today will go, it will be a 2-hour symposium with a break in between. We will be hearing from Brent, Evan, and Brandon, as mentioned. We'll also be hearing from researchers within our 2-hour symposium. And you can use the Q&A button to pose a question at any time. I will do my best to get to them. Thank you, Margaret. Now we will be going to Dr. Charlotte Henson of the Trauma and Recovery Research Unit at McMaster.
Thank you so much for that introduction, Dr. Margaret McKinnon. My name is Charlotte Henson. I am a postdoctoral fellow in the Trauma and Recovery Research Unit at McMaster, and I'm also a former firefighter with 4 years of experience in France. Today, I'll be presenting some of the lab's most important data on PSP mental health. More specifically, I'll be talking about the impact of COVID-19 on PSP psychological well-being and address some of the personal, team-related, organizational, and public-related challenges that have been exacerbated by the pandemic. Because of the pandemic circumstances, PSP are at risk of experiencing more severe adverse mental health impacts. More specifically, as the number of people needing care increased daily, PSP rapidly faced unmanageable situations, leading managers and leaders to reframe work and organizational policies. PSP were expected to provide an increased number of services with reduced human and material resources, creating a heavy imbalance that amplified distress. These new stressors faced by PSP included extreme workloads and understaffing, increased risk-taking and stress associated with the fear of becoming ill, organizational pressure, lack of communication and support from supervisors, difficult decision-making, and isolation. Despite us highlighting PSP's experiences in this presentation, it's important to note that we, as well as participants, acknowledged that the pandemic has also deeply affected managers who were equally faced with major challenges. We also want to mention that we realize some of the data may be difficult for PSP leaders to hear. However, we bring this information forward with the intent of showing our support to PSP organizations and helping leadership work hand in hand with their staff, as the data we present constitutes our basis for creating recommendations that should help increase staff well-being and ultimately employee retention. Because of the challenges brought on by the pandemic, public safety personnel became even more at risk of experiencing psychological distress and, more specifically, moral injury. Moral injury can be defined as profound distress that can arise in the aftermath of situations in which one's moral or ethical beliefs have been violated. Specifically, moral injury is understood as the negative outcomes following exposure to potentially morally injurious events, also called PMEs. PMEs include certain situations where an individual's actions or inactions transgress their moral values, or where someone may witness actions or inactions that transgress their moral values. It's important to add that PMEs can also include situations in which an individual feels betrayed by another person or by an organization that they believe has a duty of care for them or for others. With this arising new form of psychological distress, PSP are at risk of experiencing more severe trauma, which is why the Trauma and Recovery Research Unit at McMaster has been investigating the impact of the pandemic on PSP mental health. Specifically, the True Lab, and especially the researchers you see listed on the screen, aims to raise awareness about these challenges and to provide efficient solutions to address them. The study I'll be presenting today has two parts. First, I'll talk about the results from the quantitative portion of our study that assessed PSP psychological well-being, and then I'll present the data from the qualitative portion of our study that investigated the different challenges caused by the pandemic. We had 668 Canadian PSP respond to our survey, with most respondents being paramedics at 38%, then firefighters at 21%, and smaller numbers for the other PSP occupations. Most participants were between the ages of 30 to 39, 50% were from Ontario, and 35% were female. Our results show that 21% of participants experience severe or extreme levels of depression, 25% experience severe or extreme levels of anxiety, and 16% experience severe or extreme levels of stress. Additionally, almost 39% of PSP meet the cutoff score for PTSD, 57.10% for burnout, and 16.31% for moral injury. Lastly, 3 out of 4 PSP scored above normed average for difficulties in emotion regulation, and 1 out of 5 perceived low levels of support from their organization. For the second part of our study, 60 PSP agreed to participate to interviews, which first highlighted issues on the person level for our participants. More specifically, PSP mentioned having difficulties enforcing COVID mandates that conflict with personal beliefs, such as enforcing restrictions on individual autonomy and keeping people from being with their family and friends. The second theme at the person level described situations in which PSP failed to prevent harm to patients by following COVID protocol. For example, paramedics described feeling like they wasted valuable time by having to put on their PPE before assisting those in need. The next theme was the team level, and again, there were 2 sub-themes. The first addresses situations that involved inappropriate conduct among colleagues. These situations including witnessing others lie or act in a dishonest manner about their work, or witnessing others act in a stigmatizing way towards minority groups or vulnerable populations. The second sub-theme involved increased tensions among teams due to masking and vaccine mandates. This was reported in several of the PSP occupations where there were polarization among team members regarding COVID protocols. This led to a negative change in the way PSP viewed their colleagues and the greater public. Our data then highlighted some important organizational challenges for PSP. Specifically, paramedics reported system-level problems whenever they were asked to transfer elderly patients from long-term care to hospitals, knowing that they also risked exposing their patient to COVID and potentially infecting other residents at the long-term care facility. Another sub-theme involved PSP feeling that their own safety and well-being was not a priority for their organization. Staff members mentioned situations such as excessive overtime, not having access to PPE, or only to expired protective equipment. PSP also shared they felt that their professional opinions were disregarded by leadership and other PSP occupations, causing them to feel undervalued. And lastly, PSP mentioned often being reprimanded by their leaders for acting in accordance with their moral imperatives. Indeed, some participants described policies that actually felt like a violation of their moral code and values. For example, some PSP explained they were instructed to refrain from providing assistance to individuals in cardiac arrest due to a high risk of getting infected with COVID. Our last sub-theme involved public backlash during the pandemic, which was greatly associated with increased distress in PSP. More specifically, PSP speak about the public's tendency to put their needs first instead of the common good, as a large portion of the population was unsupportive of vaccine and mask requirements. Additionally, PSP mentioned they felt that their own well-being was completely disregarded, especially when being exposed to people who lied about their COVID status. And lastly, PSP mentioned they felt that the public abused the health system by asking for unneeded assistance to emergency services that were already saturated. Therefore, the pandemic has created a profound gap between PSP and the public they serve, as the crisis context has enhanced more self-centered behaviors within individuals instead of a community-based mindset. Overall, the key findings from our research suggest that PSP experienced a wide range of PMEs during the pandemic. It's important to note that an important number of PMEs were experienced at the organizational level, resulting from feelings of betrayal and frustration towards the organization. Therefore, Canada's emergency services are at risk of losing a large portion of their staff. As a matter of fact, our data shows that out of 192 PSP, 94 say there is more than a 50% chance of them leaving their organization, while 83 think about leaving their profession altogether. Because of these alarming numbers, our team at the Trauma and Recovery Research Unit is currently working on writing some important recommendations for PSP organizations. These recommendations aim to provide leaders with some important guidelines to help improve PSP psychological well-being and make their mental health a priority. Thank you so much for your attention. I'd like to pass it off to the moderator.
Thank you so much to Charlotte and to the True Lab for those results. Some sobering statistics, some good phrases that we can learn and we can all be on the same page as we talk today. Now I'd like to invite our first fireside chat panel. 3 people will be joining me. Brandon Currie is a Vancouver firefighter. Brent MacIntyre is a sergeant with Ottawa Police, and Evan Gagnon is in dispatch with the Ottawa Paramedics Service. Welcome to all of you. How are you doing today? All the mics are up and all the cameras are up. Excellent. I'd like to just quickly hear from everybody to start this conversation. What were the biggest challenges about doing your job throughout the pandemic? It can be one thing that you choose. Perhaps there's a list. Maybe I'll start with Brandon.
I would say that one of the biggest challenges was that everything we trained for our job changed. So any sort of like muscle memory and all those different things that we've had in place that really made our job calmer because we could rely on our training was all out the window, because every call we went to was completely different now. Our safety protocols were different. Everything was different. So it took a lot more brain power to do just the simplest calls, because we really felt that we were needing to re-engage our brain and think and make sure that we're doing new protocols. And then again, those protocols are changing weekly and daily. So
and the muscle memory is so important in your work. Yeah. Brent, what would you say?
I would say we had people that were, loved ones that were getting sick, and they weren't just getting sick, they were being hospitalized. And that was a real change. It would be like every once in a while in your organization, a message will go out and they'll talk about, so-and-so is, it's been hospitalized. but we had dozens of people and their loved ones were being hospitalized. We had people, it was unprecedented, the number of people that were going down, and you could see your coworkers not coming to work. They were isolating at home, or that their loved ones were hospitalized. And that was a real turning point for us, where you start looking at this like, oh my God, this isn't happening in a far off lands. This is happening right here in my organization. The stresses that we're facing. I mean, you're talking about officers that were being exposed and contaminated, what we would call it, contaminated, and they'd have to decontaminate back at the station. You're basically going through a whole decontamination system and putting them back out on the road with a brand new clothes, and we're bagging their clothes. They're basically walking through our some of our parking garages naked with just a Tyvek clothing on, and to have to go get rechanged to go back out there. And how do we, this is kind of something totally new for us. It was the moral injury of sort of like, and I have to go back to work after I've had a very traumatic thing, and I could potentially bringing this sickness home to my family and infecting my own family. We heard a lot about that. So those were some of the things that, the sheer amount of the stress of affecting the personal, and then also in the professional, and how the two sort of interlaced with each other. Pretty crazy.
Absolutely. There were so many things that were eye-opening about that time, but the interconnectedness of all of us at work, and then as well with our families, and then especially for frontline first responders, for sure. Evan, what would you add about what were the biggest challenges about doing your job throughout the pandemic in dispatch?
Yeah, so a little bit similar to Brandon's point, where there was so much unknown and countless changes that were happening daily. So between your shifts, even if you're working day to the next, there could be a change either within the internal protocols of our workplace, being allowed to, if you would be cleared to work, you would. So there was countless changes for that, and also on the protocol side of things, there was countless changes to protocols, questioning, just the muscle memory, like Brandon was saying, was just gone, where we used to be able to rely and do multiple things at once, where now we had to focus on this new change that overrode the last change, but then who knew what the next change was going to be. So it was definitely very difficult just to manage that continuous changing. It kind of felt like an overload of information, and just we kept getting the training bulletins nonstop, it felt like, for that time.
Mm-hmm. And so just to stick with you, Evan, for a bit, and to understand the daily ways in which you do your work, if I were to call 911, would I get you on the phone?
Yeah, so if you're in I'll use Ottawa for the example. So if you call 911, it'll go to our primary answering point, which is Ottawa Police, who will ask you, do you want police, fire, ambulance? If you ask for ambulance, then it'll get transferred over to our center. And then you could potentially get me or one of my colleagues on the phone, asking you questions and sending you help.
Mm-hmm. And so, of course, if we think back to 2020, and it was very scary times, everything was changing, but 911 calls did not stop. And as I understand it, you work from a script?
Yeah, so we're very protocolized within the EMS world and the EMS dispatch world. So we're overseen by the Ministry of Health, who puts out a protocol that we must follow verbatim as it's written. And that's the same for everywhere in Ontario. So you'll get that consistency across the board. So everyone working EMS dispatch in Ontario would have been working with the same changes, same script. So just the same feelings, essentially.
Mm-hmm. And so the calls to 911 did not stop, but I'm wondering if over the course of the pandemic, did the nature of the calls change?
Yeah, so we definitely noticed a slight decrease in calls at the beginning of the pandemic. People were calling in and vocalizing, like, yes, they wanted help, but they didn't want to go to the hospital because they didn't want to get COVID potentially. So there was a little bit of discussion there with those people of, there's only so much we can do. Like, so there seemed to be a fear of going to the hospital at first, but no, like the calls didn't stop. People still needed help, but we did notice that some people seemed to wait a little bit longer than they normally would, and then that had some negative repercussions on their health or their outcome potentially.
Mm-hmm. And were there any negative repercussions for you in the workplace in terms of the kinds of calls you were getting?
Definitely, it felt like, so at the beginning of the pandemic, we felt a little bit like heroes, I'll call it. But as it progressed, we transitioned from kind of the heroes to the villains, it felt like. Because at first there was so much uncertainty and questioning. Nobody really knew where we were going. But as the pandemic kind of grew on and COVID fatigue set in, then people started getting more and more frustrated with us, and kind of lashing out at us for asking the questions that we're asking to not only protect the paramedics who are responding, but we're trying to flag that this person is potentially COVID positive, so we could potentially protect other people as well.
Yeah, I'm so sorry that you bore the brunt of that type of frustration. You know, I remember when I started seeing signs go up in service related professions, you know, we will not tolerate abuse here. In my doctor's office, when a sign like that went up and you just thought to yourself, wow, you know, these are folks who are trying to help, but there was definitely such a level of frustration in the public. I wonder if, Brent, if we can turn to you for a moment and talk about in the Ottawa Police Service. First of all, maybe I'll just ask about public perception. Yeah, because it's what we were talking about with Evan just now in terms of the frustration that was being tapped into. Does that kind of trigger any thoughts for you when you reflect on what it was like to do your job throughout the pandemic?
Yeah, for sure. I've definitely found at the beginning, so kind of when March kind of happened and then the Prime Minister was on all the means saying, please come back to Canada from your March break and unprecedented. There was a real push for probably, I don't know, 3 to 6 months where it's like, you know, talking to PSP saying, we support the front line. I remember seeing signs and banners, you know, as you would, you know, if you're out to go get groceries, and people, they were putting signs on their front laneways and on their lawns, and people would drive by, you know, for a birthday celebration, there'd be a big parade of people all in their individual little bubble cars, and everybody's very happy. There was a real sense of we're in this together. And I actually, in Ottawa, I remember seeing a banner saying they were all in this together. But as the pandemic dragged on, then I found we were kind of being ripped apart, right? And in the Ottawa case, you can see it right up to the convoy, and where there was a real clash of ideology, and I would suggest that, you know, some of the public safety personnel took the brunt end of it, and they were, regardless of your personal views on we had a job to do out there. And I really found, if you look at some of the documentation coming out of the RCMP and other after action reports and the National Enquirer talking about, it was kind of unprecedented the amount of vitriol and hatred that the frontline workers were getting, you know, direct threats, you know, during the convoy, really confrontational, trying to, we had officers being doxxed, which is a method of where they take over your profiles, and they, you know, they're trying to heap all sorts of negative attention on individuals, targeting specific people. A real change in how the public perceived our front line as we saw this drag on. I think we're still recovering from that, and certainly I think the way that we all of us, police, fire, paramedics, CVSA, all these people that are engaged in the day-to-day protection of Canadians are the way they were viewed and the way they are continuing to be viewed. And I found that very interesting and at times quite sad and really difficult to digest. The effect of that, I would tell you, is that I'm 26 years of policing. I have never seen the number of police officers who are leaving the profession prior to the normal retirement age. Never seen it before. This is something that administrators and the executive of all these organizations as a collective are going to have to really grapple with. How do we retain people? You know, everybody talks about human resources are the most valuable asset of any organization. It's not the cars or the trucks or the hoses or the whatever it is. It is about the human resource, but we are not able to retain people. People are leaving. They're going to try different things and they're done with this job because I think it ties back to this idea of moral injury.
Mm-hmm. And Brent, you say that this is something that you've seen at work, and the research that Charlotte shared earlier definitely bears that out in terms of the qualitative interviews that her team had done as well, with people thinking about leaving their professions. And I wonder, you're talking about how stressful it was out in public as a police officer. I wonder if you can talk to us a little bit about internally with your team. What were the stressors? I know that we talked earlier, you and I had talked about vaccines, which were a very fraught topic for everyone. I wonder if you can tell us about what it was like at work.
Yeah, so I wasn't frontward facing during the pandemic. I worked in our wellness section. I did peer support. That was kind of my role and my mandate. It was so some of the like things that we, you know, really grappled with. One of the really good things is that we did reach outs to absolutely everybody that was off work in the initial stages. Like the very first time, I mean, the auto police have been around since 1826, right? As a police service. And that was the very first time that we had done a reach outs asking people, are they doing okay? And how are they doing? Do they need anything? Right. So to do the sort of like, what does peer support really look like? Is it like, how do you operationalize it? And that was something that all of a sudden I saw a huge increase. Before it was 2 people in wellness, all of a sudden I had 6 people that were assigned to the wellness section to help do those reach outs and talk to people. And you know, how was it that you're going to actually meet with people to actually have a really good conversation about how they're actually doing, because usually that doesn't happen necessarily over text message or over the phone, right? So that was like a whole new way. So I did a lot of walks in a lot of parks, socially distanced 3 feet away to try to really see how people were dealing with, right? I talked to people through doors and windows on the other side of a barrier of some sort. That was difficult. And then we start talking about you asked about like the COVID mandated vaccines and stuff like that. Like, yeah, I mean, I didn't get vaccinated until like December. We were one of the first groups to get vaccinated. And then of course, it's quite funny. It's like, yeah, sure, they're going to vaccinate all these cops. But what about their loved ones at home? It's like, sure, I'm now vaccinated, but now I have this sort of idea of a moral injury. It's like, yeah, but my wife and my children who are, you know, at the time, like they were like 17 and 15 and my wife, they're not vaccinated, or they weren't in the first wave. I got vaccinated before them. And then shortly after they started rolling it out. So that was kind of difficult for us to sort of like, a lot of people had this anxiety around, was like, sure, I'm fine, but what about the people I love closest? What about my aged mother who has, you know, stage 2 cancer, right? How come she didn't get a vaccination right away? You know, and I know this all takes time and this was unprecedented, but these were things that we were hearing about. Is like, how do I put my mind, or how do I go to work and knowing this, right? And then if you kind of look at like the mandate, I mean, we have 2,200 employees. We had 98% of them were accepted the vaccination, that they vaccinated. But you know, if you look at 2%, we still had 40 to 60 people that for whatever reason weren't getting vaccinated. And some of those people had really strong personal views, and other people, like I found it was really polarizing within sections, right? If one person didn't get vaccinated for whatever the reason was, they felt, you know, that there is like us versus them, right? And I even saw it. It's quite funny. It's like people would talk negative about their peers, right? It's like, how stupid are they? You know, how dumb is this? How stupid is this? Right. And without really having not context to it, right? And because there could be many reasons why people weren't getting vaccinated. I found that was polarizing, and it sort of ripped apart this idea of teamwork. And this idea of we are all one team, we're all on one side, we're here to help and support each other. It didn't always play out that way, and that was very difficult to come to terms with. And those have had lasting effects for sure within our organization.
Mm-hmm. Mm-hmm. And teamwork is so important for all of your professions. And I heard a few words there, Brent, like us versus them and polarizing. And I'm sure that has like a real fraying effect on the ability to do teamwork. Brent was talking a lot about going for walks in parks and reaching out to fellow colleagues. And Brandon, I want to turn to you for a moment to tell us a little bit about the ways in which I think you did similar types of work working in mental health. And I'd like to know how you would encourage decompressing after challenging calls during this time period where everybody had to be publicly distanced.
Yeah, I mean, with all PSP, like our one of our biggest thing is social connection and social kind of that integration and that connection and seeing people's faces and reactions and be able to like look at somebody. And we like Evan was talking about, like our calls didn't change. We still went to traumatic calls and we still went to the same things as we did before with an extra level of stress, but then we'd have to kind of now after a traumatic call, we typically would have a crew talk as a diffusing to kind of talk about the stresses that just took place. But then we couldn't really do that as we were like distancing our crews from different crews and things like that. So we had to try to be nimble and figure out how do we do a diffusing over the phone or through a window, and like how do we talk to our crews to make sure they're okay after a bad call through like some sort of distanced way. Because again, that we had no protocols for this. This was never really a thing. So, and then again, from that stepping into it of like, we have all very like physical jobs. And one of our biggest ways to cope with stuff is physical activity and move your body and go and do those things to kind of release that energy that, you know, balance out the hormones and stuff like that. And it was really difficult for a lot of us who couldn't go to the gym, couldn't go to play hockey and couldn't do those normal ways of coping. So essentially from that, they had to figure out how do we basically deal with almost like having some sort of like almost like an injury where you couldn't move your body. You couldn't you could do the same things that you would normally do. You couldn't go for your normal whatever sport you play. That was your place. That was your safe place that you could go and do. So it really affected a lot because we lost that. And then on top of it, we're at the highest level of stress we've ever kind of experienced in our career. So it was really like two colliding forces at the same time. So again, we just really tried to just hammer home. Like we used Zoom a lot. We used the internet a lot, trying to like get information to people. And I think that was one of the best things out of this whole thing is that generationally, the older generation on our job were forced to learn tech and forced to learn how to use the phones and forced to use Zoom and forced to use the websites. So we now had access to them. And that was one of our best things, is because now we could actually reach out to them and say, hey, like these are your resources. We'd love to see you in person, but we don't actually need to right now because we can just give you that information. So we were able to kind of move with that. And that was a positive way of moving through the whole system of it all at the end. So
totally, things don't change, right, until it breaks. And once it's broken, it's like, okay, now we got to do something. So then everybody sort of tries to pivot and they're like, okay, this is why Ottawa Police uses Microsoft Teams, right? This is exactly why this is happening, right? And before that, we were kind of stuck in 1994, right? Like it was like, oh, spreadsheets and whatever. We didn't do any of this type of stuff. So I found that, yeah, for sure, that I see a link between what was happening in other organizations, what we were doing. And it was like, all of a sudden it was a mass, like we have jumped years, decades, because it was like we were forced to do this. And I thought that was actually, I guess, one of the positives that came out of this terrible thing, right?
Yeah.
Well, yeah, you know, Brent and Brandon, I know that you both really work with your peers a lot, fostering peer support and talking about mental health. And I can hear that you're both fairly glass half full type people, because you're talking about the positives that came out of like more connection, more ability to digitally connect. Were there certain things that you learned throughout the process? Because Brandon, as you mentioned, we had never done this type of thing before. I say the collective we, right? Trying to connect. Were there things that you learned from your colleagues as you were imparting, you know, advice or having conversations about mental health digitally?
Yeah, like I would say just sending the text messages, I would say, is one thing that came out of it, is just sending a text to check in on people. I think that became very normal. Because we had the same thing, polarizing kind of groups, that we wanted to make sure that everyone, like people would actually, I felt when they would call our wellness team, would actually be stressed out because they were like, hey, I essentially like I caused this. I'm not vaccinated. And I'd be like, stress is stress, right? You're calling me for stress. And it doesn't like your views don't matter like to me in the sense like we're here to talk about stress. And there was one of those things where people would literally be ashamed by calling because they needed help and they were like feeling like left out of the group and different things like that. And so it was just a normalized stress. That stress is stress for everybody. And that it doesn't matter what your views were. We're just going to talk about just the science of what's going on behind the scenes right now, and that we're all feeling the same thing. It's just different sources right now. And yeah, it was definitely, but just those text messages, I think, were one of those things to just keep connecting with. Texting older generation again was a new thing, and just checking in and being like, how are you doing? You're off work right now, or whatever it is. And it's like, yeah, do you want to go for a walk? Do you want to go meet at a park? And those were kind of like things that we would kind of do, but we really force ourselves to kind of go and sit at a car, 2 cars away, whatever, right? And just chat, right? So it was, yeah, and we're all just being nimble and listening to other different departments, different groups, seeing what they were doing and be like, that's cool. I like that. I'm going to work with that. So, yeah.
So being proactive and reaching out. And
Yeah.
also, it really seems that in terms of the peer support networks, which predate COVID, a larger picture proactivity, proactively going after educating on the science of stress, as you said, Brandon, which I really love, because then it takes kind of the onus off the person. We are all just hardwired to react in certain ways. Evan, I know that the Ottawa Paramedic Service also has peer support, and I'm wondering, you do work in a supervisory role. I'm wondering whether you recommend peer support or how that works for you.
Yeah, so we do have an internal peer support group, which has always been fantastic. And then because I have been in a supervisory role for about 5 years now, people usually turn to us first, and then we can kind of coordinate the peer support. We can offer a little bit ourselves, but some of us aren't necessarily trained. So we can definitely refer them to somebody who can give them a peer support session. And there has definitely been an increase since pre-pandemic to post-pandemic, or even during. There's a lot more sessions that we have to either mediate or organize. And we're referring people a lot more often to the city's kind of helpline that we have for this type of thing as well, if it has to go past peer support, if they need additional help that peer support can't necessarily offer. So like refer them to a psychologist and stuff like that. We've been referring a lot more people to the city's program as well.
Yeah, I think it starts so much with leadership. Like you don't understand. Like, yeah, it's great that an organization has a peer support program. That's like, I think it's mandatory that every public safety personnel organization has one. But the reality is that people want to know their leaders give a crap about them, that they care about them, that they want to know that their leaders know them and promote their interests, both professionally and personally. And if they don't have that, if you don't do this as an organization, guess what happens? You get people leaving because they're going to go find it somewhere else. And that is key. So once you start talking about really what is peer support, what is wellness in an organization, it is talking about how do we make a culture where you feel supported. And I'm telling you right now, it's so important that these organizations get that. And if they don't get that, they're not doing their job. I don't care, like, because when you start looking around organizations, fire chiefs and police chiefs and all these people, they're politicians. At the end of the day, they're politicians, and they have to start looking at the organization and say, well, how do I make sure this organization is going to continue past me? And the problems that we have within Ottawa Police, it does not rest with the current chief. It doesn't even rest with the previous chief. It's probably 4 or 5 chiefs where we start cutting people, cutting human resources because we got to meet political ends, because budgets can only increase by 2%, but cities grow by 7%, right? So it's like, well, at the end of the day, it culminates to a situation where we have this unprecedented health pandemic, and we don't have enough people to actually do the job. And I'm telling you right now, you will get people 100% coming to work, engaging and doing their job, and continue to come back if they know that they're supported by their organizations. And when they're not, then you see people pulling pin and saying, I'm going to go do something else with my life because this isn't for me. And it comes down to that.
I would love to hear from all of you, actually, if you can think of examples of ways that leadership show that they cared or that they were plugged into what was happening among staff. If we kind of reach back in our memories, think about 2020, 2021, 2022, Ottawa Convoy for two of you, you can think about, do you have any examples of when leaders really conveyed that they were in it with you and that they knew what you were going through? I'm opening that up to anybody. And as well, for anybody who's watching, you can drop questions in the Q&A button, just letting you know that we will try and get to them. But Brandon, Brent, Evan, who would like to start?
I can go ahead there. Definitely, to me, at a minimum, is come see your frontline staff.
Yes.
Come chat with them. Come see what the reality is. All these changes are coming from, in our case, from the Ministry of Health or potentially internally within the city. And it's coming, all the way down to us. We're the ones enforcing the new protocols, the new protocols to ask people, the protocols to come to work and stuff like that. But it felt like there was that disconnect between, here, do this, but we won't ask how it's going or what's going on with it, right? So it felt like there was that disconnect there sometimes. So just come to the dispatch floor, talk to people, talk to your frontline dispatchers who are doing this work. So that definitely felt like there was a disconnect there for quite some time.
You know what I want from my leaders? I want them to be like Iceman. I want them to be like, don't worry, we got this, everybody. We got this. The world is falling apart around us. There is like unprecedented. And I want them to be like, all right, I know which way we're going. We're going in this direction. Everybody follow me. It's going to be fine. We're going to be fine, right? Even if they don't think it personally, it's like, it's not going to be fine. They're freaking out. But I want them to be showing leadership by saying, yeah, follow me. I have an idea. I have a plan. We're going to work collaboratively, and it's okay. It's going to be okay. If they don't do that, people are like, the ship is sinking, and they're rearranging deck chairs, and we don't know what we're doing, right? That's my fear of organizations, right? Is like, it starts so much with leadership, because you could have great wellness, and for Ottawa Police, what did they do? The first thing they did right after, COVID hit, everybody comes back from March break. I mean, they augmented, I got 6 new people in the wellness section so we could start doing these things. They didn't do this until the thing broke, right? And so I was like, okay, well, that's good. I'm glad leadership, we're showing leader, okay, these people aren't doing these jobs over here. We can we got the right people in the place. We can help augment the wellness section. But it's like, what I want from my leaders is like, I got this, you got it, we've got it as a team, we're going to work together. What we saw in Ottawa Police didn't always translate that way. And it was panic. And when panic, and they didn't walk the floors of 0 level and 0-0, where all the troops are actually marshaling to go out to their cruisers and to do that. They didn't come down. And when they came down, it was not what we wanted to hear from them, because it was, people, they had to let their emotions get away from them. So leadership is about keeping your own emotions in check while the world falls apart around you, right? You talk to, we're in a paramilitary organization, right? Start looking at people that have actually been through military conflict or something, a disaster. It's like they gravitate towards people who are calm, clear, and collective. That's where we need to get going. And if that's the one thing when I give talks to leadership and what leadership means, I'm a lowly sergeant, man. I've been around and I've seen a lot of things, and I just tell people, have that idea of what you would like to see in your own, if your own life was falling apart, who would you gravitate towards? And that's what you got to be for the people that work with you, right? That's what we need. So
I was just going to add, Brent, that it's just like how we are on scene. We're calm,
Yeah.
collected for the public, and they look to us as if the world is crashing and we know what's going on. And we're figuring out as a team, but we're calm and collected, and so they are calm and collected because they're looking to us. And that resonated with me, in the fact that we literally do that for citizens.
Yeah, but we don't do it internally.
Yeah.
How crazy is this, right? The big fireball comes out of the house. You're like, okay, we're going to get some ladders over there. We're going to get the boys block off these streets. Coppers do this. Paramedics get on standby. We set up triage stations. We can do it all. But internally, it's like, the sky's falling. And you're like, oh my God, right? Really? This is what you think leadership is, peeps, right? I think we're growing, we're changing, we're getting better at it organizationally, but man, there was some growing pains here, man. Growing pains for an organization. And it played out for Ottawa on a national stage. And it was terrible for the rank and file because they were going out day after day. I worked 18-hour days for 42 days. 18-hour days. I slept sometimes in my car to go back to work, right? I worked in a command center as an operations chief. Like, I never stopped, right? Right up to the time when we talked about the convoy, when we finally were able to safely end the unlawful demonstrations, right? It's like, it was, and then the ramifications out of that have been, we are still like licking our wounds collectively, I would say, in the Ottawa. I don't know, Evan, if you think that, but like that was like, you got to think of it. It's like when I look at the COVID whole timeline, it's like that was a pretty major thing that we can all point to in our organization. It's like, holy cow, right? Like, this is what it culminated to, right? And the injuries that came out of that moral injury of the organization about how they see themselves in the world. Pretty telling.
Brent, you're totally right that there was a national spotlight on the Ottawa Police Service, and then also to another degree to Ottawa paramedics as well, with the convoy. And I wonder if we can talk about that, because with all of that spotlight and with all of your internal challenges as well, how did you deal with, earlier the word disconnect was said. I think disconnect is a really powerful word, because there's what you're doing internally, the job you're trying to get done, and there's the public perception, and then there's a lot of scrutiny from people even outside of Ottawa. I wonder how you dealt with it at that time, Brent, when you were working 42 straight days.
How do we deal with it? You know what? I don't know, folks. Like, it's like, it is what I find, but public safety personnel do best. And I'm telling you, like right now, the grittiest people I've ever met are PSPs. People that when it gets bad, they dig deep, and they dig deep internally. And what I noticed amongst the people is like, I don't really care what the superintendents and the deputy chiefs and chiefs are saying. They're saying what they need to say for the public to hear it. What they cared about is what their sergeant and staff sergeants were saying on the line, right? We are going to all go out there together. There was like homicide detectives that put on a uniform, first time in probably 10 years, to walk out and to listen to people scream at them about COVID vaccinations. And like, that's not their job. Their job is to solve murders. But they went out there anyhow to do that job, because we're all frontline workers, and they are gritty, and they are people that will dig deep, even though they didn't want to be out there in January in -40, and it was blistering cold and terrible, and getting yelled at and screamed at, and all these other things. And I'm telling you, post convoy, it's like I had many people pull me aside about Pierceport, and they say, when they see a hockey stick on a Canada flag, it drives them bananas. It's like two iconic symbols of how we see ourselves as a nation. And they're like, I found this like incredibly difficult, but they kept coming back, and they kept going out there, and they would make sure they would hold the line. They would make sure that they would enforce the laws where they could do it safely. They would make sure that the convoy didn't expand. We would redirect people that were trying to come in and fortify them. They were trying to do everything that they could, and they cared because their sergeants and their staff cared about it, right? And that's, I think, is like a true test of what a public safety personnel is. They care about the people that work directly in their chain, right? They don't care about the figureheads and the people that want to climb the ladder and be the chiefs and all that. There's an important role for them too. But what they actually care about is their sergeant and their staffs that are right next to them, and giving them good advice. And that's how I found, it's like, I look at the glass half full, and that is the grit that we have, right? And if we can get a little bit of grit and gratitude, develop that on your teams, you're going to save your organizations tons of headaches later on, as people decide, am I going off? Am I going to change jobs? Am I going to leave this organization? All the rest. Those are the types of things they've got to really promote within organizations. And I found that's the good stuff. That's the good stuff within OPS.
Evan, did you want to add anything about just handling the pressure of the Ottawa convoy?
Yeah, and I'm sure Brent and Brandon can both agree with me that with anything PSP, regardless of what you throw at us, we make it work. Doesn't matter what the situation is. We're short-staffed, we're struggling, we just make it work. And a lot of us will self-sacrifice some stuff to make it work. And then you'll often see people just they've given it their all. They've made it work for too long, and that's when they start burning out and they just can't do it anymore. In the case of the convoy, just geographically how it was set, we had one or more ambulance crews in that area on standby just to support not only the officers that were in the area, but I might not agree with you taking over the downtown core the way you're doing it, but if something happens, we still have a duty to help you, and you're still a human being that deserves help, regardless of what your beliefs are. So, and then we were getting intel back from even the paramedic crews that were there, that they were getting, yelled at, insulted. There was a couple of times that racial slurs were said to these paramedics who were just there in case something happened. And they even if something happened right after you insulted that paramedic, he would have given you the best care possible, right? So it was tough hearing that back from the paramedics that were frontline, right? And then there was some situations where there was delays getting to other patients because there was people part of the Freedom Convoy who were blocking off streets that we were trying to get through and wouldn't move. So this other person who has a delay getting an ambulance that potentially would really need it, they didn't ask for this. It doesn't matter what you're, if you're for or against the convoy, this person deserves help.
Yeah, for sure. I know I've talked to a lot of our dispatchers within OPS, and during the height of the convoy and the height of COVID, they were being phone calls from around the world, basically tying up our 911 lines and saying absolutely terrible things to the people that were answering the calls. Like things you would never say to your worst enemy were being said to them over the line, right? And it's very hard to work through this. And at first, the organization was like, no, well, you have to answer these calls. You have to listen them out. You got to determine whether or not people are just phoning to scream at them and to say terrible things to them. So it's like, eventually the organization is like, okay, once you determine that it's no longer an emergency, you can just hang up on them, right? Like eventually, they're tying up our lines, and people who are actually ill, because the city goes on, right? We were dealing with something in the downtown core, but things in Barhaven and Stittsville and Canada and Orleans still happen, right? People still need paramedics and fire and police to go to those normal calls for service, right? And we need to be able to get that information and dispatch it out. And the world still moves on, right? And it was like, so finally the organization, as the executive says, okay, yes, you're allowed to, get rid of the riffraff. But it wasn't until at first people were having to listen to this, and that was very difficult, right? And yet our people still came to work. Crazy, right? They still came to work every day knowing what they're going to face, put on a headset, they're going to listen to people to say terrible things about them and their family and their gender and everything else that you would never say, right, in normal conversation, but they still came. Like that, hats off to the men and women that work in our dispatchers. Hats off to the people who work all behind the scenes that were targeted the same brush as the frontline police officer wears a uniform out there. Hats off to those people that come in day out and still do this job, right? That's what I love about these organizations, right? And finally, if our leadership could actually listen to this and be like, you're right, I do need to support them. And it's much more than playing lip service to what the friggin' out there with the public wants to hear. This is about supporting our members and making sure that their best interests are taken into heart, right? That's where we get better.
Thank you for saying that, Brent, because something that I've often thought about is when it comes to this verbal abuse that is just so heinous, the types of words you would never repeat. Sometimes these things don't get said precisely because we don't want to repeat these words. And so a lot of the time it stays kind of behind the scenes. So I'm glad that you're talking about it. And Evan, something you said really struck me about how PSP just get the job done no matter what. Brandon, you and I spoke previously. We met another time, and you told me a lot about the stoicism that's involved in your job for all of you. And it strikes me that that is the best part about a firefighter arriving on scene. For someone in an emergency, you want someone to be displaying those attributes, but also it may be part of how PSP workers, why you are paying the price, you know, the name of this symposium. There's a cost ultimately to always getting the job done. And I wonder if we can just touch on that briefly, Brandon, about the kinds of things you talk about in terms of letting the stoicism go, when to have it on the job, and when you need to let it go.
Yeah, that's something that we really, that's our big push right now, is to talk about stoicism and how it works so well for us on the job. So when we're on scenes, all PSPs have it, where we have that stoic face where nothing gets to us. We're good at it. And that's why, like, just back to like the whole leadership talk I said, like the public looks at that as we're the litmus test. How's everything going? You see the fireman, you see or firefighter, and they're calm, we're gonna be calm, right? We collect ourselves at the door and we step into screaming. And that's kind of so, but the issue is that works really well. But what happens is that we sometimes forget to take that stoicism, that we call the empathetic armor, we forget to take it off. So when we go home, we're still looking at the world through that plate glass window. And we kind of aren't engaging with the people around us because we still have that barrier between us and the world around us, because again, that kept us safe at work, but it's not needed at home. And so we're even teaching, like we have our video series that we teach out here, is that's a maladaptive behavior. That's something that works well at work, doesn't work at home. And so we're trying to explain this to our membership, of just being like, we don't want you to lose it. We want you to learn how to take that off. And so when you do go home, you can actually connect, like truly connect with your family. Because we've all done it. We've gone home, we've been sitting there just kind of like blank stare, and the kids are crashing around you, and just like, you know, or your spouse is telling you about their day, and they're, you know, they've had a hard day, and you're just kind of like, just nodding. Nothing's really registering in and out, because again, you're still kind of like left in that feeling of like protection mode. So we're really trying to teach that to our new generation coming through, but then also too, like, it's sad, but teaching it to the older generation as they head on to retirement, and being like, I'm really sorry you didn't learn this before, but we're going to teach it to you now. And that's one of the biggest things is that we hear is, I wish I learned this 20 years ago. I wish I knew this information back when I started, because I wouldn't have, you know, I would have been different as a parent at home, or as a spouse at home. So but that's our big push right now, is being like, what you're doing is great. It's your coping ability is what's got you here. It's why we're all really good at our jobs. And we need that to be on scene. We need to be like the strong stoicness. And then we also need to be able to step back in the hall and have that vulnerability within our crew, and be able to have that peer support where we can actually be, okay, looking around, like, that sucked. That really sucked. And like, let's talk about it. And we can have that open vulnerability at the hall. And it's not weakness. It's the fact of like, we're a family here, we're strength, and we're going to be together, and we can actually talk about it more. And then as you step home, being like, yeah, like, and being able to talk to your spouse and your partner, whoever's at home, who's greeting your dog, you're like, that sucked. And being able to step away from that and take off that armor, and being like, okay, I'm at a grocery store. I don't need to be on the hypervigilance right now. I can actually engage and just talk with someone. So yeah.
I love what you're saying, Brandon, and I think that people who are here listening are loving it too. I see a lot of reactions, you know, with the reaction emojis in the Zoom, and I have a feeling that people are really relating to the things that all three of you are saying. So just before we head to the break, because I do need to wrap up this portion of the symposium, I would love to give each of you an opportunity to tell us what you love about your job. Brent, after 26 years, what do you still love? What are your favorite parts of the day?
Favorite parts. It's the people. It's the people I work next to. I love working in small teams to accomplish tasks that most people could never do, right? I did that when I worked on the dive team. You know, I love the idea that we can do it, but not everybody can just walk in and do this. And I love that. It's the acknowledgement that we're not robots. We have this emotional side to it. And once organizations start looking at Like when we start developing leaders in an organization, it's got to be the emotional intelligence is one of the most important things. Yes, you have to be competent at your job. You have to have an idea of what you're doing and all the rest. But it is about that. And I love when you connect with people in a team, you accomplish something that's so difficult to do, whether it's organizing a response to a protest, or looking for an object underwater, or fighting a fire, or attending somebody in a critical incident that got involved in a car accident, or whatever it is. I love that idea of that teamwork, and that's what keeps me coming back here, is like, yeah, we are doing something that not too many people can do, and that always feels very gratifying. And at the best part of it all, that you're actually helping people. Like, I think that's one of the things that most people join the public safety personnel, like, to actually help people, right? I'm not a desk guy. I barely know how to use Zoom, right? But I like helping people. And that's why I joined this. And I like doing it in a teamwork. So
Really appreciate that. Evan, what do you still love about your job?
It's gonna resonate what Brent was just saying, but yeah, like at the base, we all came into this job to help other people, to make a difference in our communities. We dispatch quite a large area. We're like a large chunk of Eastern Ontario, so we get to help a lot of people, which is great. And the people aspect is the other thing that keeps us coming back. So, the people we're shoulder to shoulder with, we see them more than we see our own families. So we essentially become a family. This happened years ago, but we had organized a Christmas platoon dinner at a restaurant. So we reserved, quite a few of us went, and it was great. And the waiter at one point asked if we were family. And we were like, we're just a bunch of coworkers. And he was very surprised by that. But it's crazy how, we work 12-hour shifts. So you spend so much time, so much night shifts, like you go through so many emotions together. So these coworkers that we're going shoulder to shoulder with, they become a support system to us at a certain point, because we will, bring some stuff home to our families. But personally, thinking I'm protecting my family, I won't share everything, but I can go into more detail with my colleagues who have been there before, right? So they become a support system to us as well.
Thank you, Evan. And Brandon, what do you still love about your job?
Yeah, it's challenging, but I love it. It's the team. That's exactly it. It's that we can go to it's the change between a traumatic call and a non-traumatic call within reason is being around a team that you trust and you can lean on. And we've gone to horrendous calls, and then you look back and you go like, that was really bad. And you're like, but I was with buddies. I was with my friends. I was like, we got through this together as a group. Whereas if you don't really know the people you're working with, because again, you transfer into different places, you're like, it's a bit different. It's not the same as when you have that, like those people that you really know and you can trust and lean on, where you can be that, just, that them, their step, where they're going, that organized chaos is going to work, right? And that everyone's going to come back again. When everyone leaves that truck, everyone's got their job, everyone's going to come back, and you're like, we're doing it. And it's just one of those things where it's such a cool job, where again, like all the PSBs, no job, no day is the same, and every day is like a little puzzle, and you get to kind of figure out little puzzles and get to help people, and it's just like, it couldn't be better. So yeah.
Well, I'm so glad the three of you are in the professions that you're in. And I'm so happy that you could join us today to really share very openly and honestly the challenges and the joys of doing the work that you do. So thank you so much to Brandon Currie, Brent MacIntyre, Evan Gagnon. Thank you for your service, and thank you for being here today. I want to just quickly take it to the break, because we are going to have, let's say, an 8-minute break. I'm sorry I went past the hour just a little bit. So we'll take it to 12:13. Please, do your thing, grab a snack, etc. And then we'll be back for more conversation. Thank you so much. Hello, and welcome back to our symposium called Paying the Price for Safety, Public Safety Personnel, Moral Injury, and the COVID-19 Pandemic. We had a wonderful conversation just before the break, and now we are moving to our next fireside chat featuring 3 researchers. I'd like to welcome and introduce the 3 of you to the stage. Dr. Andrea Brown of McMaster University's Trauma and Recovery Research Unit, Dr. Rose Ricciardelli of Memorial University of Newfoundland, and Dr. Joy MacDermid of Western University. Hello to all of you. Nice to see you here. Hi. And I think we're just waiting for Rose to turn on her camera and mic, unless it's just in my view, but we'll give her a moment. We heard from our panel before the break, and perhaps there were some stories in there that really relate to your own research. I'd love to start with you, Joy, if I can. Maybe we can start with you telling us about your research with firefighters and some of the themes that come up in terms of mental health.
Sure, I'll talk about one of our recent studies that was done partially during the pandemic and since then. And it was a qualitative study, which means we interviewed firefighters for fairly lengthy interviews across Canada, including multiple provinces and a couple from Nunavut. So we really tried to be inclusive of different provinces, different types of firefighters, and representing both men and women. And then we analyzed that, and I'll focus on some of the themes that are most pertinent to today. When firefighters talked about some of their challenges, and we called it two sides to the coin, sometimes in the paper, that there were things that they felt conflicted about, and that these sometimes went in relation to our talk today about moral injury, some of the conflicts that were spoken about in the first half. We certainly saw firefighters talking about some of those themes. And so, as expected, around critical incidents, the firefighters often reported having a lot of angst and guilt and about situations where they were unable to save people, or coming into a really traumatic situation where they thought they were going to be able to save the person and that mission failed, and they felt that they had let the person and the family down, obviously. But they also, on the other side of it, also felt guilty about what we call compassion fatigue, that they just see so much. So many critical incidents, so many drug overdoses, sometimes the same person, week after week that they have to go to for a drug overdose, that they develop compassion fatigue. And they felt guilty about that compassion fatigue, even though we know that's a really important coping mechanism in some ways to protect them. They also feel guilty about it. And then when talking about their families, they talked about also that although their families are who they ideally would have as the most trusted people in their lives and they could share everything with, and that they recognize that their families were incredible support to them, they also had some guilt that they couldn't always be fully honest, they felt, with their families to protect them, mainly to protect them against the terrible things that they were seeing in the line of duty. They wanted to protect them. And they also were protecting the fire service sometimes. Sometimes they wouldn't tell their family members things to protect the fire service so that their family member would still think the fire service is a good place to work. And it was very important that their families think the fire service is a good place to work, so they didn't want to compromise that. But they felt they were guilty about being dishonest in some ways with their family. And that's why, as we heard in the first session, it's so important that firefighters, public safety personnel, they can talk to other people that do the same work as them with complete confidence that that person understands what they go through, and that's incredibly important to their mental health. And then the final place where they felt guilt was relation to their colleagues themselves. Often if they were mentally unwell, or they felt there was a certain situation they couldn't address in the field because of post-traumatic stress disorder, maybe, they really felt guilty about letting their fellow firefighters down. And so they couldn't always be there for them, and they really felt guilty when that was the case, because as we heard, teamwork is so important. So that study was done with career firefighters, and that's published, that study. We've also repeated the same study and the same questions with volunteer firefighters, because one of the unique things about firefighters, of course, is that about 80% or so of the firefighters in Canada are actually volunteers who do this as a volunteer job. And they face unique situations because they often don't have good equipment, they don't have healthcare or resources, they don't have programs, they might have difficulty in accessing programs, so that was a bigger challenge for them. But they had the additional moral challenge that many of them come from rural communities. So if somebody is injured or dies, they often have to see that person's family week after week when they go to the grocery store, when they go to a family event. They often know they're the victims, and that creates an additional burden for them.
Yes, it's so interesting. I didn't know that stat about 80% of firefighters in Canada being on a volunteer basis, and then hearing about the additional burdens for those who do this job in a volunteer way. I wonder what you can tell us about your research and how we can strengthen how research can be applied and put to good use, and how to help PSP workers with their health.
So the main thing is we want research to help us identify which programs work and who they work for, because often it's not one program works or it doesn't. It is, this program might work for this type of problem or this type of person or in this situation, and this type of program might work in another situation. And so that's a really important thing for research to help identify who gets what. Often when I talk about to public safety personnel, they talk about how important it is to sort of have a tiered response to mental health, that in their training and orientation, there should be certain programs. And then, there's an advanced level of resiliency training. And then there's chances to update your information or booster shots of your training to make sure that that mental health information is layered. And it also doesn't just include like online, there has to be in person. It doesn't just include peer support. There has to be community supports. The healthcare system is really important and often a big gap in terms of mental health services. So that layering of all the programs. One of the things I think is a unique challenge in this sector, and I've been in it for a while, is 10 years ago, I would say the problem was we didn't have enough research and we didn't have enough programs. And thanks to quite frankly, to research that showed the high prevalence of mental health disorders amongst our public safety personnel, the government has invested, and municipalities have invested, and research organizations have invested in research and programs. However, it's a very challenging area to do the kind of research we typically do in healthcare, where we compare one intervention to a control. Mostly because there's such an urgent need, we want to rush right into having programs right away. And unfortunately, what we know from health research, there are cases where that happened in the past, even for some fairly invasive surgeries, treatments like surgery, where when we did compare them to a control, we found out that the treatment was either not helpful or even harmful. And by that time, it was very entrenched in the system and a lot of money was being spent on it. So to get that balance of getting programs out to the public safety community in a timely way, while also making sure that the research is rigorous enough to make sure that we know which programs are working, has been a huge challenge that we're really still struggling with.
Especially because, as you say, different programs work in different contexts or for different workers and different environments. I wonder, are there any specific characteristics of programs that you find to be very useful, or any programs, you say there are a large number of them. Are there any specific programs that you'd like to name check that do work?
I don't want to mention any specific programs, but I will say that one of the things we hear a lot from public safety personnel is right now they're feeling overwhelmed by how many programs are out there, how many things are being offered to them as the cure for PTSD, and this will solve your mental health problems. And this is, some of the programs, it's hard to tell the differences and similarities between those programs. So we did do a study again where we interviewed firefighters who took different programs, and we interviewed people who taught different programs to try to look at some of the similarities and differences. And there is a lot of overlap between different programs. But some of the things that we heard from people in terms of what's a good program look like is there should be active learning. So scenarios and role playing, not just PowerPoint presentations and lectures where you work through a module and it's quite passive, but it was really important that the way that it was taught was interactive and had scenarios where people practiced the skills. And the other thing that we heard from is really important, that it was delivered by someone from the field. So whether it's a paramedic or a firefighter, that the program be delivered by someone who really understands the field and the issues, and that it have both the mental health professional component, but also that that it not just be a generic program, that it be very specific to the specific public safety personnel group.
Mm-hmm. That makes sense, because especially as we heard from the panel earlier, there are very specific work challenges depending on the role, of course. Thank you so much, Joy. I'd love to move on to Rose now, and I'd like to remind the audience that if you'd like to ask a question of the panel, you can definitely. Joy, I didn't want to lose you, but it's okay if you want to go off camera for a minute. We will keep you in the conversation for any questions that may crop up that I can pose to all of you, and or if we have audience questions, I'm very happy to relay them. So thank you, Joy. Rose, I'd love to hear about your research. Specifically, it focuses on corrections officers, and I'd like to know what you found are the biggest issues when it comes to moral injury, specifically for corrections officers.
Well, for correctional officers, it's rather complicated because the moral injury is layered. So one of the places where it starts is, and we see this in the longitudinal study, that the majority of persons entering the field, over 90% of our sample, they enter with genuine rehabilitative orientations. They've joined the profession because they want to work in public safety. They want to make a difference. They've experienced adverse events, adverse realities. We actually have, it's almost 90% of that same population. And we did do 1,200 baseline interviews where we do see trauma in people's histories. So they enter the field with this idea of what they're going to be. And one of the first very, very simple states of moral injury arises when you see people not take advantage of everything that's there. So you can be in a maximum security unit, have a behavioral counselor who's there and free to talk to anyone, and no one choosing to talk to that individual and to do those things that would be self-betterment in many ways. Or they choose not to attend their programs. They don't want to work on their education. So there's those kind of more minor things. There's also the moral injury that arises when you see someone doing really, really well for a period of time. So, and it can be simple. It can be, you see a person who's in a max security unit, get moved to a structured living unit, do really well, not self-harming, really doing well, and then suddenly something happens and they're right back and they're going to the hospital. So it's that, because you start to care. And one of the things I've really seen in the correctional work, particularly when I was visiting an institution recently on shift, is the degree of compassion. There's so much compassion, and it's not compassion that was put on for myself, as the compassion I saw wouldn't have been possible if they didn't have the rapport and the relationships with individuals already, because they knew what people were doing, what they were working on, what was going on in their lives, and they could talk about it and check in with people as they did their rounds. So it was very, very consistent. So when you see yourself doing so much for someone and seeing them not doing it for themselves, there is a moral injury. And then the most pronounced understanding, if you're in another public safety profession, for example, if you're working in the policing realm, in firefighting, in paramedicine, intelligence, any of these other organizations, if something happens to you, you're on a unit and you've been attacked, you've been stabbed, you've been killed. And I know that is a more diverse and maybe a triggering example, but one of the challenges is that person is already in maximum security. They have nothing's going to happen differently for that individual. We have removed all the consequences, such as with the move to segregation. That's no longer legal. So you have an individual who can take a life. They're already serving a life sentence. Nothing will come of it. They might get a consecutive or a subsequent sentence that they serve at the same time, or they might get a minimal fine, $500, $50, etc. So that feeling that there's nothing you can do and that you're so undervalued. If it was a police officer and a life's lost, that perpetrator would be put in prison. They'd go into a maximum security unit, where for these individuals, there is no real consequence. Their life will remain unchanged. They'll go back to their cell. In the same context in COVID, it was really interesting. I just analyzed this data, but it wasn't a moral injury that, for example, residents in prisons were getting vaccines first before they qualified, because the prisons were vaccinated, all the residents, and then the officers were vaccinated based on the distribution in their home province. And what I found really particular there was it wasn't necessarily that they were getting it first. It was when people were refusing it, or when they felt unsupported by their union or employer because they didn't want the vaccine. So moral injury, it's very complex in the prison space. It looks like much of what we see on the outside, but I think a lot of it comes also because of that rehabilitative orientation. And we know with the traumas, with the realities of what people experience on the job, those trauma responses, they will have to put up boundaries and walls to protect themselves, which is not what we want to see. We want it to be rehabilitative. The other thing I find is public perception is actually very trying. In the longitudinal study, I can tell you, for example, that at recruitment, many of the individuals I talk to, they're bright-eyed and bushy-tailed. They're really excited. They really feel they're going to make a difference in someone's life. And they also are aware that there's a very polarized view of officers in the media. So what that looks like, some people want, and I'll use the Bernardo transfer, for example. Bernardo transfer is not a challenge. It is actually legal and it is the law. You cannot do anything other than that. But people want Bernardo in maximum security. They want officers to be goons with batons. And at the same time, people who have loved ones who understand prison want officers to be rehabilitative and caring. So no matter what you do and how you present, half the population is not going to agree with you. And what I see among the recruits is they think people might have negative views of officers, but I'm going to be one. And how can they have a negative view? I'm going to show them what it's about. And then over time, someone has said to them, same as they've said to me for the research I do, how can you do that job? How can you work with people who cage people? That's a quote that was said to me once. And the challenge then arises where you feel that no matter what you do and how well you do your job, you can't break that public perception. And if you can't break that public perception and you feel completely devalued and poorly portrayed in the media, that is morally injurious. And that follows you everywhere you go. So it's very layered and it's very nuanced and it comes from many different layers. And because of that, no one is necessarily immune because it comes at from all different angles. You have an individual, they need a CPAP machine. In the prison, they get it in 2 weeks. In society, it takes 18 months, right? So there's these really challenging nuances that underpin that injury.
As you speak, Rose, it really makes me think of, you said it's a multi-layered moral injury for corrections officers. And research that was presented off the top of the symposium where Charlotte was talking about the sub-themes of moral injury when it comes to personal, teamwork, institutional, and public perception. Seems like the public perception aspect for corrections officers is quite fraught, specifically in this field of work.
Well, it's difficult in something like a prison. There's a lot of commentary always happening because prisons cannot be transparent institutions because they have to protect the confidentiality and the human rights of everyone within them. So there's never going to be an ability for the officers to speak their side. And even if journalists want to, no one will speak with them. So how do they report, which causes frustration and harm too? So if you put all these different layers together, it's really hard to get a comprehensive story. And often what is shown and what is presented is a little snippet of a use of force video. And that is not going to show the consequences, the realities. It can look like someone's using force with a prisoner, but you might not realize there's a whole group of other prisoners who are ready to attack as well. And maybe the force is being used because there is no alternative, or it's being used to preserve life. So when we see these little video clips, they're doing nothing to help how people are presented. And they're often, and there's sometimes where they're clearly problematic, and I'm not defending that. There are problematic times as well. But for the most part, a lot of these, if you look at the greater context, it's a very different story. But we don't get that greater context because it cannot be shared. It would violate the rights of that individual.
I wonder, Rose, if any of your research looks at parole officers. And I ask because there was a question from the audience about why are parole officers not included in the risk and exposure, just like correctional officers. And they say that many correctional officers move to parole officer roles. I'm wondering, Rose, if that's part of your research.
It is. We did interviews with 150 parole officers and published a 74-page report, as well about 6 or 7 different articles, and a book is forthcoming on this very thing. In parole, what we see more than anything is vicarious trauma. And you're completely right, even in the longitudinal study, we have a huge portion of individuals who move into parole or move out of parole. which is less common, but still happens. So we have done a lot of work in that area, but I will qualify. I was asked to speak directly about correctional officers, not correctional employees more broadly. So that's where my focus was today. But it's not in any means to leave them out. Program officers as well. We've just completed 125 interviews, and we're working with management as well. And hopefully over time, we'll be able to look at the entire correctional service. And what I will put in the mental health disorders paper that was recently published, you'll be able to see that we looked at everyone working in correctional services at all levels and all employment positions. And we looked at mental health prevalence individually for each provincial and territorial service in Canada. And then we put them comparatively in that table, in that paper. So I think they'll be able to shed a lot of light on how it's not a hierarchy of positions. Trauma, people, no one's immune to trauma. So we see it a lot in the correctional services.
Mm-hmm. And does your research include recommendations, or is there anything you can tell us today about what might improve the situation in terms of moral injury for corrections officers?
In terms of moral injury, it's a little bit more difficult. I think a lot of things that we've already heard said are very prominent. I think greater recognition of moral injury. I actually, when I started doing this work in the correctional officers, it was at the request of UGO-SAC-CSN, which is the union, in one of their annual triannual meetings, where they really realized it was something that was resonating and we needed more information on it. And, you know, some of the things that we can do are rather simplistic, low-hanging fruit, telling someone they're doing a good job, checking in on an individual, explaining that, you know, when you see those things, when I was in that institution, there were moments of pure compassion that I had never seen such compassion in my entire life. I will say that. And I was in an institution and no one was doing it because I was there. It was authentic and genuine. And if we can have a better understanding of the compassion in those institutions, we can understand more why things hurt. And if we can have more understanding, we can give people more space to express what's bothering them and also to be able to manage them. And I would just be repeating Joy if I talked about how there are things that we can do, but until we have, you know, real evaluations with control groups, I'd be very hesitant to make any recommendations in terms of more specific programming.
Well, thank you so much, Rose, for some insight into your research. I would love to turn to Andrea now, who is with McMaster's Trauma and Recovery Research Unit. Your team has been doing research for the last 2 years, interviewing PSP on challenges they faced during the pandemic, specifically around mental health and moral injury. And we heard some of the kind of quick statistics of your findings off the top of this symposium. I'm wondering if you can tell us a little more about the themes that you've uncovered.
Thanks, Hannah. So Charlotte went over a lot of the themes that we've found in our research, but I'd really like to highlight that a lot of our themes also were brought up during our earlier panel by Brent and Evan and Brandon, which is really gratifying as a researcher when the panel unprompted starts talking about your findings, right? So what are some of the things that we're finding is the importance of teams. So they were talking about it becomes an us versus them, and how in the pandemic, there's been one of the main findings that we found is where there's a potential moral injury is the division between teams, right? So in these jobs, and I just want to qualify this with saying that every service had its own unique stressors that people had to endure, and then there were some that just went across all of the different services, which was evident by how Evan and Brent were talking about, yeah, me too, like that's what we have. But in these, one of the main findings was that the impact that COVID had on teams, and how there was kind of a fracturing, mostly in terms of COVID vaccines and masking mandates, right? This was really important because when teams work together, they talked about how these are families and how trust is really important when you're doing your job. And if you are working with somebody that you don't feel is taking care of you, or if by, let's say, not masking or not vaccinating, or if you feel that somebody's not listening to you and doesn't support you because they're pushing this on you, when this is not something that you believe in, it fractures the trust within the team. And that was one of the things that really came through in our research that was really impactful for public safety personnel. There was also the heroes versus villains, and the impact of the public came through, and how public safety personnel are really helpers. You heard on the panel, they talked a lot about helping. I also like to think of them as protectors. And this is something that lasts with them. It's inherent to public safety personnel. I've talked to a number of people who've left and they still have it. They still want to help. But when you are helping people and you're not feeling like they're helping you, that can really impact your job, right? And that can be whether or not they're supporting you by vaccinating and wearing a mask when you're out there putting your life on the line to help, and then they're not willing to do this, or whether it's the violence that we were talking about, the verbal abuse that was brought up and also brought up by one in the Q&A, which is paramedics and nurses are also facing this. Like, this is something that's really impacting public safety personnel and also healthcare providers. And I just want to acknowledge that paramedics, they straddle both, right? So they straddle both the healthcare worker and the challenges healthcare workers face, and the public safety personnel and what public safety personnel face. And one of the things that Charlotte brought up was the number of, and also Brent brought up, is the number of people who are leaving or planning on leaving public safety jobs. So 1 in 2 PSP that we surveyed had a 50% or higher chance of leaving their organization, with 44% a 50% or higher chance of leaving their profession altogether. And some of those, the main reasons for wanting to leave were the mental health impacts of the jobs, what they consider poor working conditions, including that verbal abuse, right? Or the pushback from the public, feeling dehumanized by the organization, how your leadership treats you, and how you perceive that they treat you is really, really important. And I think that came through in the panel very strongly as well. And then also the pushback from the public. So we, as a research team, were coming up with some recommendations for organizations, public safety personnel organizations. And I thought that I might be able to contribute to this panel because we've heard about mortal injuries. Rose has done a wonderful job talking about our corrections officers, and Joy's done a wonderful job talking about firefighters. So I thought that maybe I would just contribute by adding this. And some of the key things that we're going to be talking about is the importance of making sure that your staff feel seen and valued. And that's the term that I believe Brent came up with. You want to make people feel seen and valued. You want to recognize that your public safety personnel staff, that's not their job, isn't just them. They have families they worry about, right? They were concerned that when they were going back home, that they were going to give the virus to their families. Like, what kinds of things can you implement to make sure that people feel confident that they're not going to make their family sick? That if they've been exposed, that they don't feel like, oh, I'm just a cog, now I have to go out and do it again. What are those kinds of things that you can do to make them feel seen, make them feel valued, to support the staff and empower them? Communication. We heard a lot from our participants that there were so many policies, there were so many changes, there were so many procedural changes. Those were really challenging for people to stay on top of. They wanted to have clear directions. They want to know how to do it. And when things are changing all the time, or if they disagree with it, voice their opinion and it's not incorporated into the decisions, that's also disheartening, right? So you need clear communication, but also to listen to your staff. And mental health supports. I am blown away by how proactive so many organizations already are, but those mental health supports are key to making people feel comfortable doing their job, being able to go out and do their job again. So those are some of the things I want to contribute.
Absolutely. And we have, as you said, Andrea, heard several themes crop up from the earlier panel, but also in this one. And so definitely a lot of interconnectedness of issues. I'm wondering, when your trauma and recovery research unit, throughout doing this research, were there any surprises or anything that you uncovered that was unexpected?
Well, it's interesting you say that, because I was coming into this with having done a lot of research also on healthcare providers. So I'm bringing that up. And one of the distinctions that I noticed, so moral injury, it's it happens when you do something or you see something that goes against your values, but it can also be a betrayal by an individual or an organization. And one of the surprising things for me was seeing with healthcare providers, there was a lot of things that they had to see or things that they had to do that was the moral injury. With the exception of paramedics, who also fall within both groups, the PSPs, they tend to have more of that betrayal. And I think that's why the public backlash was so hard on so many people, but also the institution feeling that supported by the organization is key for public safety personnel. And if they're feeling that level of support and the lack of betrayal, then it is my belief that they're more likely to stay within their jobs. So that was something that I found surprising, that there's the differences in the types of moral injuries that were promoted by both groups or endorsed by healthcare professionals and PSP, but also the fact that paramedics straddle both. So it was a particularly challenging time because they were seeing they had all the moral injuries or the potential morally injurious situations that healthcare providers, which is, for example, when showing up on scene, a paramedic might be there for a call, and the potential patient is alive when they go to put on their gear, their PPE. But by the time they get the PPE on, now the person is dead. So it's a totally different type of call. And all the while that they're putting their PPE on, they're also, the family members are panicking and saying, you got to get this done, you got to get this done. But it's something that they had to do for themselves, for their own safety, for their family safeties, for the safety of their team, right? So there were a lot of challenges that paramedics straddle both the healthcare providers and the PSP world. So that was a surprise for me.
Mm-hmm. And I want to pick up on a word that you mentioned, Andrea. You said betrayal. That can be a real characteristic in terms of a potentially morally injurious situation, feeling betrayed by your organization or perhaps an individual. I wonder if I can open this up to everybody, because I would love to dig deeper into what is an example of that. What does it look like if a worker feels betrayed by their organization? Shall I start with you, Andrea, since you brought up the term?
Absolutely. So many of what was mentioned in the panel is I'm showing up every day for my job, right? I'm showing up every day, but we also had, because they're helpers, because they're protectors, because this is who they are, and they're going to be there regardless of how they're treated. But if a public safety personnel is feeling betrayed by the organization, let's say they have to engage in a behavior that goes against protocol in order to save a life or to keep safety, and then they are reprimanded for doing that. So their job is, let's say it's a police officer, to serve and protect, to endorse safety of the civilians, right? And then so they do something that they need to do. They engage in a behavior that they believe is going to protect them, but then they're reprimanded by the organization. That could be a betrayal. Or even sometimes the policies themselves or procedures were seen as a betrayal of what they need to do and who they are.
Mm-hmm. I wonder, Joy, I see you nodding. Are there is there anything that relates to your own research in terms of betrayal?
I think we hear people talk a lot, and it relates to stigma, that public safety personnel are encouraged, come forward, talk about your mental health struggles. We're there for you. There shouldn't be any stigma around mental health, and come forward. But sometimes when they do that, they feel either their confidence is betrayed because it's, the information maybe is shared beyond where it should be, or that they're treated differently by the organization. They may not get promotions, they might not get an active role. So despite the fact that they were encouraged, come forward, this is a good thing to do, and there's no stigma, the stigma is still there, and the consequences to coming forward are still there, and they feel betrayed by that. And then a second level of betrayal sometimes happens in the healthcare system itself, because they then come forward for treatment. And I've talked to some firefighters who said it was my fifth therapist who was actually able to help me. So that coming into the healthcare system, either not getting access to care or getting access to care from people who don't understand what they do and the nature of, just say, well, avoid that stuff. Well, you can't avoid that stuff if you're in a public safety personnel. And so the total lack of understanding of the context, and then treatments that don't work and waiting on wait lists, that also feels like a second level of betrayal, because now they've come forward to the healthcare system and their needs aren't being met.
Thank you, Joy. Rose, do you have something to add?
Definitely. So I think one of the key sources of betrayal, and I'll try to be very quick, is one, investigative processes. I think you're making split-second decisions. Everyone questions themselves for the most part. We always think of what we wanted to say or do 3 hours later. We can plan it out perfectly. So I think that moment of needing to act and then being held to account for a split-second decision in a very potentially life-threatening situation is really challenging. And I think if you feel unsupported by your colleagues, or if you feel unsupported by your management or by your organization, I think that feeling of betrayal is really long. And if I use the example in Newfoundland, where I am, in the provincial system, we had a death in custody, and it resulted in everyone from the correctional manager down on shift being charged. And that was a horrific trial. It was traumatizing to everyone. It was horrific presentations of them. And the judge actually said it was a catastrophe how they were treated. And it's true, but that betrayal isn't going to go away quickly. And when you're doing your job, knowing that you can die in the line of duty and people can't give you 2 seconds of flexibility because you're making immediate decisions under a lot of pressure, it's just really saddening. So you'd feel betrayed by colleagues, betrayed by senior management, your organization, maybe even your union, and then betrayed by the public who don't even understand the context you're working in. So I think the investigation themselves, and an investigation occurs with every use of force. So it really needs to be recognized, and we need to do more to be supportive of individuals after they experience events.
Mm-hmm. I think you've struck a nerve, Rose, because I see a lot of reactions from the Zoom audience. And as well, there's someone who just quickly commented that betrayal means not enough staffing. So I'm not sure what field they work in, but that's another example. Thank you so much for that. I wonder if there's anything specific to your research that you heard in the panel before the break from Brent, Brandon, and Evan that you wanted to follow up on in terms of your research. Because I think something that's so powerful is obviously the story of lived experience is so powerful, but then as well, qualitative and quantitative research that backs up the stories that we hear is also so powerful. Was there anything that specifically touched you in terms of the stories that you heard earlier?
Can I just add a bit about, Brandon was talking about coping and how coping styles had to change during the pandemic. And this came up a lot in our research, because traditional methods for coping, like the debriefing, you couldn't do that. You couldn't go and just spend time with your family because you had to isolate. You might not even be allowed to be with your immediate family. So one of the things that I wanted to just highlight is that we did some research on coping and what was really effective for people, public safety personnel. And we found that spiritual well-being was something that came up. Self-compassion was something that came up that we weren't necessarily expecting, but also perceived organizational support. So really promoting that again. Perceived organizational support is seen as a form of coping that if you have perceived organizational support, you are going to be better at coping with all the stressors that came forward during the pandemic.
All great points. I love also that you bring up self-compassion, because for people in helping professions, which all the PSP fields are, and I know many people are gathered here to watch and to listen, I really think that coming here to learn is an act of self-compassion. So I'm really glad that the audience has joined and looked up all the information that you're sharing today. I'd love to just wrap up the conversation by asking, what do you hope comes out of your research? Andrea, you specifically said that there are recommendations coming out of your research. Where how will this research have legs? What would you like to see?
Well, I would like to see I just want to qualify this. I've seen great change in PSP organizations over the last decade. Great change with respect to mental health, but I would like to see more mental health supports put in across the different services. I know that some services are really promoting mental health and other ones aren't. So that's what I'd really like to see.
Thank you. And Rose, I see that you're nodding. What would you like to see come out of your research?
I would like to see more policy change, both at the federal, provincial, and territorial levels. And I think we're on our way to doing that. We've already had some great successes in policy change and greater recognition. I'd like to see more understanding on the side of the public. That to me is exceptionally important. For people to be more aware of what happens in correctional settings. You know, carceral spaces aren't just prisons. Community corrections is real. And every space in society is carceral for somebody. There are boundaries, there are spaces. And we need to be more aware of those individuals, maybe less judgment, less stigma, not just at the public safety personnel, but also the people of whom they show their compassion to. And I would really like to see more evidence-informed research with control groups, doing evaluations. So we're not just investing in things, we're investing in things that work. And even looking at the things we already have going on, evaluating to see how they're working and what's not working, and making them into what they're supposed to be, rather than always going for something new and shiny. There's stuff we've got. Every organization has something. So let's make sure it's working, and then let's build to fill in the gaps. So if we can use an evidence-informed approach, I think we can have a healthier society over time. But I do science, so of course I think science is the way forward.
Well, that's very well said, Rose. I agree with you. Joy, what would you like to see come out of your research?
Oh, well, I agree with everything that's been said, and I would echo it. So I guess I'll say ditto first. And then I think one of the great things that's happened is the collaboration between frontline public safety personnel, leadership in public safety management, unions, and researchers together co-creating the research. That's been a really positive change, and I think it needs to continue, and we need to learn from each other. As researchers, we need to make sure that the questions we're addressing are the ones that are important to the public safety community, and the public safety community needs to know, as researchers, we're the ones going to be at the table saying to them, you need a control group, you need to do this, so we can have confidence in the research and to respect that what we bring to the table. And I think there's been great progress in that. The other thing is if all of the public safety sectors are changing. They're changing in terms of the training to get into the sectors. They're training in terms of the demographics. And so we're seeing this big time of change. And I think there's opportunities there for change in culture as the public safety sector starts to more reflect the communities. And that I think there's a lot of opportunity for realizing how diverse populations are, how diverse people are, and tailoring things a little bit more. So, because I think there has been some dehumanizing that Rose has spoken about so much of the public safety sector, and that's bad for their mental health, but it's also bad for the health of communities. So I think that that's an area I'd really like to see some more dedicated research and focus and knowledge mobilization, so that communities realize how hard the job is and how much we need them.
Well said. Thank you so much, Joy. And thank you to everybody on this panel, Andrea Brown, Joy MacDermid, Rose Ricciardelli. I want to thank you so much for sharing today and for the work that you do. And I want to welcome back Dr. Margaret McKinnon.
Thank you, Hannah. And I think, again, thank you to Rose, to Joy, to Andrea for really sharing that hope that comes from research and knowledge dissemination. So reflecting an understanding of the experiences of public safety personnel and how that can be translated into whether it be organizational guidelines, novel intervention, prevention, and peer support programs. But really what I would like to do now is to really, again, thank the PSP community for their service. I think what we heard today were the stories of people. And so understanding that people who join PSP service want to support others, want to support the well-being needs of other Canadians, but that comes at a cost to them as persons and at a cost to their families. And they talked a lot about joining, Brent and Evan, as well as Brandon, talked about joining the PSP community to help others, but as they do so, it comes at a great cost to them, and they're expected to be the ones who always show up, who know what to do, who have that stoic armor that is, as Brandon was saying, can be removed later. But when when people respond to calls and respond with that service, Canadians see them as being there to care for them and help them. And that's what they do every single day. And the pandemic made, I think, the conditions under which PSP operated, it worsened some of the experiences that we're having that we heard about today. And I think what we need to do at this point is to think about the lessons that we have learned. It's great to have events like this, which discuss the experiences of people and in relation to the service and care that they give to others. But how do we now move forward, as Andrea and Joy and Rose were talking about, to leverage those lessons towards change? So I wanted to end on that note of hope, but also thanks, and thanks especially to Brent, to Evan, and to Brandon for coming here today and talking to us. This event is being hosted not only live today, but will also be hosted on our YouTube channel in perpetuity, so that the wider Canadian community can have the opportunity to learn from and benefit from the stories that were shared today. I want to also, in conclusion, also thank you, Hannah, for all your work to moderate this session. You're a very well-known and very well-respected Canadian journalist who's conducted podcasts, for example, on race and how race impacts Canadians. And that's a podcast that's available right now. And Hannah, maybe I'll have you post that in the link, as well as how Canadians dealt with financial issues during the pandemic. I want to also thank Ward One Studios and Timber for helping us. I want to thank the Trauma and Recovery Research Unit. Andrea is here representing a very big group of people who have worked incredibly hard over the past 2 years, 3 years, in fact, to really represent and share the stories of PSP and healthcare workers. So I want to thank those individuals as well. And finally, again, just to end on that note of service, recognizing, appreciating, and valuing the service of public safety personnel, of those who serve at the front line, other leaders who also experience services and sacrifice that can be very difficult for them and their families as well. And helping again to bring that family together, because I think the COVID-19 pandemic was a time in many ways of fracturing. And now as we stand together to support one another, how do we bring the family together to support one another? Coming back to that story of people and how we join these professions to help, and in doing so, we join in service to one another as well, to support each other. So thank you so much, Hannah. Thank you to everyone who participated today, to the audience. We really look forward to continuing to work with all of you, moving forward to make the services and the sacrifices of PSP seen and heard, but also to learn so that we can do better in the future. So thank you.
Thank you, Margaret, and thank you to everybody who is watching, and to PSP workers everywhere. Thank you for your service. Have a good day.